Good morning, good afternoon, good evening, wherever you're joining us from today. It's one of those topics that I like to talk about. They're very ever topical. And today we're talking about uterine fibroids. We're looking at what the causes and treatment options. And today I have a very important guest with me, she's my guest, but she's going to be asking me the questions because we want to hear this not from the medical point of view. We want to hear it from the patient point of view. I know it's not. I'm not saying that you have fibroids. I'm saying that you represent women. You know the things that agitate the mind of women.
I don't have fibroid.
Okay, yeah. So and that's why it's so important that doctors should just not sit in one corner and be talking about what they probably have never experienced. So it's always good to have people like you. It's really my pleasure to welcome Ajayi Saratu Kazim to the program today. And maybe I should just give that sometimes in Abuja on the 11th of June also we'll be having a live program, hangout on infertility and fibroids in Abuja. And we'll be talking about both infertility and fibroids. But today is just like a teaser to that program, that hybrid program. So today we're discussing about fibroids and fibroids alone. So it gives me great pleasure to welcome you, Ajayi, to the program. And I'll hand over straight to you. So
All right, thank you so much. Good evening, sir. And it's actually my pleasure to really talk about this because whether we like it or not, it's something we must address. It's so rampant and very common that we can't look at it from the patient perspective, especially with all the concussions going around or all the so-called treatment options and the rest. So we need to talk about this so that people understand that it's not a big deal and that there are different options and solutions to it. So I am going to be talking about my own personal perspective and working with people, my own personal experiences as well. So, but let's start from even the beginning because some people don't really know what this fibroid is all about. It's just like fibroid. They'll just go for scan and they tell them that they have fibroid and they think that is the end of the world, that I have fibroid. So that is it. I'm done. So please, doctor, can you tell us what uterine fibroid is all about?
well, thank you so very much. Yes, I think it's a very important question and something that needs to be addressed. That fibroids are what we call, as doctors, we say they are benign masses or growth in or on the uterus. And they're so common. And one thing that we need to say straight away is that it's not every fibroid that needs to be treated. So the fact that you find out that you have fibroids, one, is not the end of the world. Two, even if it needs treatment, in 2022, there are so many treatment options now available that is not, because the moment you see why people are, when they're told that they have fibroids, why they like, it's the end of the world is because they're thinking of, oh, it's going to be surgery. I need to be operated upon. And that's one of the things that we want to correct now. That one, it's not everyone that needs to be treated. Two, even when you need to be treated, there are so many options. It does not have to be surgery alone. So, and these are very common tumors that we say that every woman below the age of 50, the risk is about 70 to 80% that you will have fibroids in your lifetime, but it's not everyone that needs to be treated.
Okay, I was actually going to ask about who is at risk of fibroid, but since you've answered the question, let's just apart from being at risk of having uterine fibroid, what are other things that the types of fibroid that needs to be operated on? When is it necessary to seek treatment if you have uterine fibroid?
Okay, well, maybe we should still talk about those people who are at risk, okay? Because age is a very important factor, risk factor in fibroids. The older a woman gets, especially when she does not have children, the risk is higher. And the older you are, the more the likelihood. I know there's some, even now, you know, I thought I'd seen a lot of fibroids, but in the recent past, I'm seeing quite a number of fibroids because we started about a year ago, this fibroid center that the only thing we do there is treat fibroids. And what we're saying now is that there's some 20-something-year-old ladies that are carrying very big fibroids and they're afraid of surgery. So age is a very important thing. The fact that you are Black also places you at risk of fibroids. Okay. People who see their menstrual period earlier on in life also are more predisposed to fibroids. Now, it does not mean that you have it. It means that the risk is just higher. People who are using birth control pills also at a higher risk of having fibroids. And of course, but the most important factor is the family history. If you have a mother or a sister that has fibroids, then you probably you run the risk of having uterine fibroids. Now, when you have fibroids, you know, the symptoms most of the time is that, and that's where it becomes tricky because so many people are carrying fibroids around and they don't even know that they have fibroids because there are no symptoms at all. And usually it might just be an incidental finding when you go for your annual medical and then the doctor says, you know what, you have fibroids. And then the typical reaction that we get, and the lady comes back from what is supposed to be an annual physical, and then she's sad because she's been told she has fibroids. But she's not asked the doctor whether this fibroid needs anything, whether she needs to do anything about it, you know. And so, like we said, that is not everyone that you need to do something about. So, but 4 things that doctors usually look at if you have fibroids. 1, whether to treat or what kind of option that you can use. 4 factors the doctor considers. 1, your age. 2, do you have symptoms at all? Or is just an incidental finding? 3, do you still want to have children? And then 4, where exactly are these fibroids located? And that brings your question, what are the types of fibroids? Okay, we usually say there are 3 types of fibroids, or 3.5 if you like, or 3 main types. We have the one that stays where the baby should be, which is the endometrium, which we call submucous fibroid. We have one that is in the muzzle of the uterus, we call it intramural fibroids. And the one that is outside the uterus, we call subserous. Now, that's why I said 3.5. This one, any of this could now, the first 2, either the one that is in the endometrium or the one that is outside the muzzle, could be pedunculated. That means has a stalk. Okay, so those are the types of fibroids. So the doctor needs to look at all these factors, the 4 factors that we mentioned, in order to say, look, do you need to be treated at all? Because let's give an example. Let's say you have an incidental finding, no symptoms at all. The woman is 45. She just went for a physical, and then the fibroid is seen. You don't, and it's about, let's say, 2-3 cm in diameter. You don't need to do anything about such fibroids, okay? All you just need to do is monitor and see, because hopefully when she hits menopause, the fibroid is going to start shrinking. So there is no point in doing anything about such a fibroid. So it's not every fibroid that you need to operate on. So there are things like, sometimes we say wait and, if you like, we call it expectant treatment management, where you're not doing anything, you're just monitoring the patient. Is the fibroid going to get better, or is it bigger, or is it going to just start shrinking after some time? So that's one way that we can, and there's some drugs that can be used, but the thing is that you cannot use drugs if you still want to have a baby, because the drugs will not allow you to ovulate, and once you don't ovulate, you're not likely to get pregnant. So, but for people who are probably are finished having their families, they are nearing menopause, drugs can be used for such people. You understand me? So that, and then of course the commonest way of treating, which is surgery. But now surgery has even turned, there's so many ways of surgery now. It's not only that you must go and cut the person open, there is keyhole surgery. And then of course, now we have things like one that you don't even cut anything at all, what we call HIFU.
Okay, sir, please. How does one know he or she has fibroid?
Wow, that's yes, that's like we said, that's it's a very important question. Like we said, that some people don't have symptoms at all. Those ones are tricky. The only how they probably find out is either they have done a scan, just like you said earlier on, and the doctor said, "Oh, do you know that you have fibroids?" But for people who have symptoms, the commonest thing is with the menstrual flow. Either it's very heavy, and you just notice that the number of sanitary towels that you're using have increased, or you could also, the menstrual period could become prolonged. So if you're bleeding for 5 days before, suddenly it's about 7 days and it's heavy. Or sometimes some people even bleed in between periods. And for some, it's just that they just notice that there's a swelling in the abdomen, you know. And then sometimes this swelling could start becoming painful sometimes. And for some, it's just that this swelling is now because it's compressing on organs that are nearby to the uterus. Either she's having, and the neighbors of the uterus are the bladder and the rectum. So a woman could see that she has started urinating very frequently. Or sometimes even I've seen people who have gone into not being able to urinate at all, what we call retention, that you know what happens with men and prostate. Sometimes it can happen even with fibroids and women. And for some is that they have constipation, they are not able to empty their rectum completely because of the presence of the fibroid. So, and yeah, so those are some of the things that may make a woman to suspect that she might have fibroids.
There's this misdiagnosis. A lot of people have actually gone for fibroid surgery and they find out that instead of fibroid, they have what they call adenomyosis. For many of them, they'll just be closed back and nothing is being done. I've seen cases like that severally. So how do you differentiate between difference between fibroid and adenomyosis?
Yeah, thank you. Wonderful question. Yeah, sometimes it's a nightmare even for the doctor, you know.
Yes.
Just like you said, many times that the doctors, especially when they've not done their investigation thoroughly enough, might not be able to differentiate between adenomyosis and fibroids. And that usually will lead to a situation where you go to the theater and then you've opened up and then you see that you cannot actually operate on this patient because the diagnosis is not right. But now a scan can help you sometimes, but you need to know what you're looking for. But sometimes no matter what you do, you need to do an MRI to be able to differentiate between fibroids and adenomyosis because they're two different things entirely. Fibroids are lumps that grow on the uterus, but adenomyosis is not. It is it's an endometriosis of the uterus. And endometriosis means that the endometrium is misplaced. So what is happening is more or less like the woman is bleeding into the muscle of the uterus. And that you cannot just, unlike fibroids that you can shell out, you can do the surgery and get away with it. With adenomyosis, you're not going to be able to do that without deforming the uterus. So that's why it's very important for us to make a diagnosis of adenomyosis before even trying to do anything about it. Unfortunately, that's a very common condition in our environment. There was a study that was done from the University of Jos, where they looked at the histology report. We do when you remove a sample from anybody, you should be able to go and look at it in the laboratory to see that what you said is the problem, is actually the problem. So we call that histology. So they looked at the histology report of uteri that were removed because of fibroids in University of Jos. They looked about 200 and something samples, and they saw that about 35% of them actually had adenomyosis, which was not diagnosed at all. So it's a very common thing in this environment, which we're probably not diagnosing frequently. Well, I think now the diagnosis is becoming better because many doctors are now insisting on doing MRI before they do fibroid surgery, especially when they're doing what they call, you think is a current, or there's a recurrence of the fibroids, it's better that you do an MRI before you go to the theater or any form of treatment that you're going to give such a patient.
Okay, so please, can somebody get pregnant even with fibroid?
Yeah, yes, people do get pregnant with fibroids, but sometimes, when we're looking at how to treat fibroids, we say we look at 4 things. One of the things is that where is the location of this fibroid? There are some fibroids that have effect on pregnancy. There's some that don't. Okay, if you have a fibroid outside the uterus, usually it does not have any effect on the pregnancy, except if it's so big that probably the uterus cannot, when a woman gets pregnant, the uterus becomes bigger over time and occupies the abdominal cavity. So you can imagine if the fibroid is already as big as about 3 months or 6 months or 4 months. So that means the space that is left is about 5 months. So such a patient might just have a premature labor when they get, because there is no space for the uterus to. That might happen. But if the fibroid is where the baby should be, it's a different ballgame entirely. That could make the woman to miscarry, could even make her not get pregnant if it's occupying the whole thing. So, but for either intramural or subserous, women can get pregnant, and then there might be no effect at all. But for intramural, sometimes also you could have what we call red degeneration in pregnancy, which could be very painful, and that could lead to admission and before it subsides and so on and so forth. So yeah, people can get pregnant with fibroids, but it's better that the fibroid is actually qualified before you attempt to get pregnant if you have fibroids.
Thank you so much. So, doctor, apart from open surgery, which all of us know that is very common for treating uterine fibroid, what are the other options available? We know there are different options right now, that with the keyhole, you talked about the keyhole and other options. So please explain more in details the options available for management of uterine fibroids.
Yeah, thank you. Yes, the open surgery is probably still the commonest means of treating fibroids, unfortunately. And that surgery really and truly, the complications that can happen from it is really not because the doctors are not good. The surgery itself is a very bloody surgery. The uterus, the blood supply to the uterus, if a woman is really, if the uterine artery is severe, you can bleed the whole blood volume in about 10 minutes from the uterine artery. So the uterus is a very rich organ when it comes to blood supply. So, and that's one of the problems that doctors do have when they are removing uterine fibroids. So, but also it's possible to do this laparoscopically or a keyhole, like you said. But this keyhole, there are 2 types. There is what we call laparoscopy, and then there's what we call hysteroscopy. For fibroids that where the baby should be, the submucous fibroid, the best way to remove them is through hysteroscopy. Hysteroscopy is like a scope, or it's like the size of a pen, just about the size of this pen, and you put it through the vagina. Is a scope, just like a telescope. Put it through the vagina into the cervix, and you are able to get into the uterus. And there's some small, fine equipment that can be used, that you can use even to remove the fibroids if they're in the endometrium.
Even if it's...
Yeah, you can. Sometimes you can do it in 2 stages. Sometimes, So, but yeah, it can be removed. But sometimes, if you look at it, if you are coming through the vagina into the cervix, into the uterus, you only have access into the inside of the, let me see if I can get it. I don't know. Aha, okay. You can see this. So if I'm coming from here, I can have access to what is there, but I cannot have access to what is there. So, and that's why the only kind of fibroid that we can use it for is the one that is where the baby should be, which we call the endometrium. If it's in the muzzle, we don't have access from the vagina. So that's the only way to have access to that is through the umbilical, just below the umbilicus, where we do what we call laparoscopy. So, but those are still, whether we like it or not, it's just, the surgery is still the surgery. It's just that your access is keyhole, okay? And so there still can be some blood loss, there can be anything. And then also it's possible to do what we call uterine artery embolization, all right? Which is, you can inject some particles, fine particles into the uterine artery and cause the uterus to be starved of blood. And in the process, the fibroids die. But you still need to touch the patient. You need to inject, you need to breach the uterine artery, you know, from either you go from the leg or you go from, so you still have to introduce something. But there is a method where you just lie down on the bed, nobody touches you, and then after 2 hours, you're told to get up, that the procedure is over. And the kind of remarks we hear from people is, are you serious? You know, you mean my fibroid has been treated? Yeah, and that's true. So this is HIFU, and that's, we say that's a non-invasive method of treating uterine fibroids.
Sir, please, how does HIFU work? Just explain more.
Yeah, you know, what I say most of the time is that the most complex things always have their principles in very simple things. You know, they said, how did you get to the rocket? And somebody said it's E equals mv squared, you know. So the same thing with the HIFU. It's based on something almost childish. You know, as kids, we will say that we used to do magic. There was no DSTV when I was growing up, so no problem. So what we did a lot of outdoor things. And one of the things that we did was that, but which we also did in physics, that if you put a magnifying lens at a particular distance to a piece of paper, the piece of paper will catch fire. You know? Yeah, because it converges, the lens converges because it's a convergent lens. It converges the ray of sunlight into that particular spot in the paper, and the paper catches fire. The interesting thing is that if you put your hand in between, you don't get burnt because the energy is only at that point, which is the focal point. And that is the principle of HIFU. Now, HIFU converts ultrasound into heat energy and is only effective at that focal point. So the machine is made in such a way that that focal point is about 12 to 16 cm away from where that lens is. The ultrasound lens, if you like, where the rays are being emitted, the ultrasound rays are being emitted. And so what we do is that the machine itself slices the fibroid into, like it slides on the machine. And all the doctor needs to do is to be changing that focal point. When he has burnt one part, he sees that the one part has been burnt, then he goes to another part until he finishes burning the whole fibroid. Now, the principle is that we are made of proteins. So if you heat, just like an egg, you know, if you have an egg and you boil it, you know, if you crack the egg before boiling, it is liquid, it spills. But if you boil it and you crack it, it's solid. The same thing, because you have boiled it, so you denature the protein. The same thing we do with fibroids. When the temperature is above 65 degrees centigrade, the cells go into irreversible damage. So they die. So what we do with fibroids and HIFU is that we kill the fibroids. So by converting ultrasound to heat energy, so it's like burning off the fibroids. But now what happens after that is that the symptoms, don't forget, we've spoken about the symptoms. It's either the woman has excessive bleeding. And why does she have excessive bleeding? Because the surface area where she bleeds from, the endometrium has increased. The moment you burn off that thing, the symptoms disappear. If it was encroaching on the bladder or the rectum, she has relief. And now, over time, because the fibroid is now dead, the woman's body starts absorbing that dead tissue. You don't remove anything. It just starts absorbing it. So it starts shrinking. Now, we have seen over time that after about 1 month, the fibroid will shrink about 30, 35%. After about 3 months, it will shrink after about 6 months, it will shrink about 50, 55%. After about 1 year, it will shrink about 75%. And we've done so many fibroids, so many big fibroids that they are like 7 months pregnancy, and we've been able to bond them. Sometimes with some of them, we have had to bond 2 times. And that's the beauty of HIFU, that is not radiation. So it's not toxic to you in any way. It's ultrasound.
That's another thing that scares people. A lot of people do not understand that it's like ultrasound. They feel it's as they're being exposed to radiation and they are trying to conceive that it's harmful. Because I've had this conversation with somebody and she felt that why would she be exposing herself? Will she be able to conceive after going through that exposure of? So please, it's very, very important for us to clarify that just like ultrasound wave is different from X-ray. They are not the same.
Exactly. And so many studies have been done. We have also done it here because on Friday we treated number 123 patients. Okay. Wow. And we looked at the figures of, we're an IVF clinic, basically. So we were able to do what we call ovarian reserve to see what the ovarian function is. And we've seen that it does not affect ovarian function in any way. So it's one, you can repeat it because it's not ionizing radiation. 2, it does not affect the ovarian reserve. 3, because it's so specific, the normal muscles of the uterus are not affected at all. So the time for you to get pregnant is shorter than any other method. Secondly, you can also deliver vaginally after HIFU.
Thank you so much, doctor. We know with other surgeries, we've seen issues of regrowth. That's one thing. We've seen people having fibroid going in for surgery once, twice, even 3 times. So for HIFU, do you have a regrowth with HIFU treatment or with HIFU that's fine now? There's no issues like that.
When we talk about recurrence, sometimes we lump everything together. Okay, let's look at surgery and then we come to HIFU. Sometimes when we talk about recurrence, it's not the same fibroid that was treated. It's some others that have grown again. Okay, but sometimes it's the same fibroid that was treated. Sometimes it was adenomyosis that the doctor did not make a diagnosis of. And so that is likely to even come back because it never went anyway, faster than the other ones. Now with HIFU, the fibroid that you kill, you have killed it. It cannot come back. But there can be smaller ones that can grow over time. That is because we've not treated those ones. And the good thing again is that HIFU can treat adenomyosis.
Yes.
So
I was going to ask this question because to me, I think having fibroid is too mild compared to adenomyosis. To me, so I've been HIFU and adenomyosis is something people with adenomyosis because I think the emphasis is usually fibroid. But a lot of people suffer from adenomyosis and they don't know of HIFU at all. And it's even more difficult to manage compared to fibroid.
Yeah, but you see, you have said it. Adenomyosis is even more severe than fibroids. Because don't forget what causes adenomyosis. You are bleeding into the uterus. It depends on what area of the uterus you are bleeding to. That's why we say adenomyosis can be focal or diffuse. If you are just bleeding into one part, then it's easier even for HIFU to treat. We just burn it off. But imagine it's a diffuse
all over
adenomyosis. Then even HIFU might have to be repeated. Okay, because you can still be having some pains after, or you're still bleeding excessively. So what we do with such people with adenomyosis is that we place them on Zoladex, gonadotropin for a while to see that what we have burnt, what is left can be mopped up. So if we are able to do that, fantastic. And for so many of the patients, we've been able to do that. But for about one or two, we're still, it's still a matter that we're still discussing with them on whether there is a need for them to have a repeat. But I can tell you for free that the best method of treatment of adenomyosis is HIFU.
Yeah, I agree. So doctors, are other doctors aware of this HIFU treatment? Because it's something that they need to know. I don't know how are they receiving it. Is it accepted by other practicing doctors as well, or they are still not accepting the HIFU treatment?
Well, I guess they're accepting it. The doctors are like every other human being. Any new thing, some people will approach it with people like, probably maybe people like me that are adventurous. We want to see, okay, let's get it done. For some people, they will say, no, let's wait and see. And then again, for some people who have had, the story of HIFU also, it's not funny, but it's not a new technology per se. I mean, the first HIFU machine in Europe was in 1994. And that was an MRI machine. Okay, because HIFU can be delivered two ways, either to MRI or through ultrasound. Okay. And that's why you see the applications can be different, because HIFU is like electricity. You can use it to do different things. Now, how do you deliver it? The way we deliver it for fibroids is through ultrasound. Why do we prefer ultrasound? Because the uterus can be as big from fibroids, can be a very big organ from fibroids. If you have done MRI before, you understand what I mean, that you are in a confined space. The transducer cannot move very far distance. So sometimes you see that when people who have had MRI HIFU, the recurrence rate with fibroids might be higher. If it's for the brain, it's better. But for fibroids, when it's big, adenomyosis, the recurrence rate might be higher. But for ultrasound HIFU, then you can move the transducer a great distance. So if you're going to do HIFU for fibroids, you're better off doing ultrasound guided HIFU. So that's the one of the things I want to remove our viewers with.
I saw a comment where Taiwo said she has fibroid and adenomyosis together. Is there any particular approach to both, or is the same one procedure?
Well, it's the same one procedure with HIFU. It's the same one. It's just that the doctor will need to do some setting on his machine, but it's the same one procedure. We've had, like I said, we treated 123. We reviewed the first 100 patients, and out of the first 100, 14 had adenomyosis and fibroids, just like Taiwo said, a combination of the two. And 6 had adenomyosis completely, no fibroids. So, and everybody came with fibroids, the diagnosis of I have fibroids. But we saw that 6 did not even have fibroids at all. They had only adenomyosis, and 14 had both fibroids and adenomyosis. So it's not unusual for you to find the two coexisting.
Dr. Please, what advice do you have for persons with fibroids?
Well, the advice I have for them is that one, is not every fibroid that needs to be operated. Two, it's not every fibroid that needs to be treated. Two, surgery is not the only option that you have in 2022. So you're better off asking for the best option that can be available to you, or all the options that are available to you, and then you can determine which one you want to do.
I just saw the comment where someone said that she's gone through mammectomy 3 times and she's going for the 4th one. Not people qualify for HIFU treatment. People that have had open cut, straight cut before, or have multiple fibroids, do they qualify to go through HIFU treatment? And are there people that cannot really participate in this treatment? What are the conditions that would prevent somebody not to be a good candidate for HIFU treatment?
Well, thank you. What we say is that HIFU cannot be for everybody, just like endoscopy is not for everybody. Even open surgery is not for everybody. There's we call some relative contraindications and we call some absolute contraindications. With relative contraindications, it means that we need to be careful. It does not mean that you cannot do it, but we need to be careful. And for such, we have to do what we call a simulation to see that it's going to be safe for you to do. Because with any method, the most important thing is your safety. All right? And so patients who are over 120 kg, we need to be very careful with them. I explained to you that the distance between the transducer and where the focal point is about 12 to maximum 16 cm. So if your fat, the abdominal fat has already taken 6 out of the 12, that means if your fibroid is the posterior part of the uterus, that's the back of the uterus, we might not be able to get to it. So it depends on where your fibroid is, if your abdominal fat is very thick. So those are the things that we look out for. So if you've had a midline incision, that is, you've had a previous surgery and they've had to cut you, this is what we call up and down incision, then we need to be careful also, because we don't, if the intestine is already plastered to the scar, then it can give us some nightmares. But if we see that we can have a thoroughfare even with your scar, then we'll be able to treat you. Patients who have had liposuction, cosmetic surgery, they also, there can be some distortion in the anatomy. So we need to be careful about these people, and we look at whether it's possible to treat them or not. These are relative contraindications. Patients who cannot communicate, because you see, when we are doing this, we need you to be able to talk to us. There's some things that we're looking out for. The complications of HIFU is completely prevented if once you have done, you are able to observe all the rules, and the rules are not many, So one of which is that the patient must be able to communicate. So and why does the patient need to communicate? Because ultrasound needs water for transmission. Okay, so you are like your tummy is like in a bowl of water. Okay, so we want to know if that water is getting too hot, and you can only do that if you can talk to us. We want to know if you are having pain in your legs during the treatment. And so communication is so important during this treatment. That's why we don't give you general anesthesia. We just sedate you so that your anxiety level is down. And then for pedunculated fibroids also, we might not be able to take that on with HIFU. Though we can, for example, you have a lot of fibroids and you have a pedunculated in the endometrium, we can treat the others and then use the stereoscopy to remove that other one. So those are some of the relative contraindications. But the absolute contraindication really and truly is when we suspect that there's some malignant changes, the cancer changes in the fibroid. We won't touch with HIFU, okay? Or if you cannot lie down for over 1 hour, either you have some back issues, you can't lie down, then we will not be able to do HIFU for you. But apart from those, every other person can benefit from HIFU.
Sir, please, this is a very important question because we know with other surgeries, you look at adhesions, scar tissue post surgery. With HIFU, do we have adhesions or
I
scar
don't.
tissue?
No, this is like we said, is a precise treatment. It goes, the focal point is only, and what we do for everybody, especially before we say, okay, go and try to get pregnant, we do what we hysteroscopy because, for example, if you have that pedunculated fibroid that is in the endometrium, we say we don't want to treat that with HIFU because that might also make you to damage the endometrium. So that's why we don't want to even touch it, So, and that's why when we finish HIFU, we do a hysteroscopy to see that everything is okay. And once everything, and all the people, we've done 14 hysteroscopies after HIFU now, out of the first 100. In 4 of them, nothing. In 10 of them, we knew that they had fibroids before we did the hysteroscopy. And so we've been able to get rid of the fibroids in the submucous space. And every other, they're good.
Because this adhesion is one of the reasons people shy away from having surgery for fibroid, because they tell you that after surgery, their period will be scanty or it might affect them or make conception difficult. So with HIFU, we don't have adhesions. Another thing somebody asked that.
No, sorry, can I say something about that addition even before you go on?
Okay.
We did a study on what you're talking about, these additions. We looked at about 900 patients who have intrauterine additions. And we saw that fibroid surgery was the commonest thing. About 50% of the patients out of the 900 patients had undergone uterine fibroids surgery. So you're very right. And it's sometimes not even until you don't see your menses after. For some, it's just there, and you're not just getting pregnant because of the scar tissue.
Somebody said, I didn't get the name. She was like, is there any solution or is there like payment plans that because the cost of this HIFU is giving her high blood pressure? She's been thinking about it. So how
yeah,
should that?
But I think there's some banks now that actually, to be precise, because I did a program with Access Bank yesterday, and I think it's one of the things that they give on their maternal and child health scheme. So you could talk to Access Bank, at least I know that, who could also help you, because I developed high blood pressure in trying to get this machine.
I actually do understand. It's not easy, but we must find a way to also get people who are willing to sponsor and at least or cut down, take some of the burden off some people. I know that's something personally I'm working on. I've not gotten there yet, but I know there are some people who would be willing to at least do some percentage and let the person cover the rest of the cost. I just want to go through the chats to see 1 or 2 more comments because I can see time is going so that we can respond to as much questions as we can. So Stroma of Express is asking, please, how much does the HIFU cost?
Yeah, well, I guess right now it's 1.5 million.
Okay. So, doctor, somebody is asking that, are you, okay, it's from the all panelists that you're thinking of setting up a fibroid foundation.
The person must be in the spirit. Yeah, we will finally try to do that. But right now,
It's something to look up to because a lot of people are dealing with having issues with
oh,
fibroids.
yes. See,
A lot.
that's the only reason why we had to do what we're doing now. And it's taking a lot for us to be able to bring the machine to Nigeria. It's taking a lot. And well, I think for me, I think it's worth it because the lives of our women is just what I think we cannot put any price tag on. And anything that will make, for example, okay, we've done 123 patients. We've not had one. Oh, I didn't tell you there is a day case. You walk in that day and you go home that day. And seriously, no matter who you are, 2 days after that, you can resume whatever your chores. You can resume everything that you were doing normally. In fact, many people, that day they walk on their own to their car. You don't need support. Do you understand? Okay, I don't have time to play. Maybe at the live program, we'll play the video of some of the people that have done this procedure to show you, to tell you how non-invasive it is. Look, it's as ridiculous as I have a patient who went to America 72 hours after having a. She came from America 72 hours after. She returned to America. We did not tell her to do that. It was, we didn't know, she didn't tell us, but that was how good she was feeling. She returned to America and then she called, she was calling with a foreign number and I said, oh, wait a minute, where are you calling from? And she said, I've gone back to America. So,
Without permission.
Say that again.
Without permission.
She had gone back without permission. You see, you know, Nigerians, sometimes we take the laws to our hands. So, I mean, but that was because she was feeling so good with herself. Do you understand what I mean? So I think for me, the what I see on the faces of people who have gone through it makes it to be worthwhile, what we have done. And yeah, somebody has to take the risk.
There's a question in the comment, but it's not so clear. She's wanted to know that she has her fibroid around the uterus. I don't know the meaning of around the uterus, that she's asked to go for surgery. Can she benefit from HIFU?
Well, we have to see. Almost every, like we said, once we don't have the obvious 3 things that are absolute contraindication, cancer, previous radiotherapy, you cannot lie down for over 1 hour. Once you don't have that, every other thing we can look at and see whether you qualify or not.
Okay. Someone said, thank you, doctor, for bringing the machine to Nigeria.
Thank you. Thank you. You're most welcome. But there's this question I want us to address. Taiwo Ajishefini says, I've had 3 myomectomies so far. The fibroids are still growing, and I saw my consultant 2 weeks ago and due for another consultation in 3 months. You know, what I would say is that this person should at least have MRI done. So that is the only thing I can add to that. I'm not saying come and see me, but you must have an MRI done so that the doctor can really know what's going on there.
Someone said, what's the equivalent of the $1,500 in euro?
Yeah, that's where it makes it very ridiculous, because it's very cheap in Nigeria now. Unfortunately, the machine is in dollars, and we're paying back in making naira. So, and that's what many people don't understand. You incur a debt in dollars, and then you are paying back making naira. It's very complex because now on a daily basis, the naira is being devalued, and it's like you can't complain, but it's like somebody is sucking your blood. Actually.
You didn't tell us the dollar equivalent.
No, but everybody knows now, if you can convert 1.5 million to dollars, depends on what you are using. Is it 550? Is it 580? Is it 6? I don't know. So everybody everybody has a calculator on their phone, so you can do the conversion yourself.
Abby? I'm not in Nigeria. I'm not a Nigerian. Wants to come and see the doctor, please, I need your contact. From Doctor, did you get the question?
Sure, I did. Well, I guess we'll give you the email address to send the mail to, and then we take it from there. So, just give me a
So that
minute.
means anybody anywhere can come down to Nigeria.
Oh,
even
sure.
Nigeria, so that you can have your procedure done.
Exactly.
And
we're having people from other parts of West Africa. We're having people from Ghana, we have from Liberia, and that's the idea that we should. There are not many people yet, but we hope that it will, and we can even organize from when you get to the airport, take you to the hotel, have your treatment, return you back to the airport. That can be done. So
awesome. That's fine.
I'm
still all right. Okay, doctor, people want to see you physically. When they go for the HIFU, they don't get to see. I went to the Fibroid Center in Lekki. I was hoping to see Dr. Abayomi, but he wasn't there. That made me sad.
Okay, you know what you can do? Just tell me when you want to come. Write an email or whatever. I'll be there to meet with you.
All right. Thank you so much, Doc. I don't know if you have any advice for all of us, because we need to understand that so according to some people, taking the child treatment, I know some of the things can help us manage, especially for regrowth. One or two things lifestyle choices, the things we eat. We are already predisposed, but we know the kind of lifestyle choices we keep will help us to help us prevent a regrowth, or to some extent reduce the occurrence or even the growth of the fibroid. Like somebody that doesn't eat healthy, you take lots of sugar, you don't eat, because we eat junk. All those things would only make our body estrogen level, whether we like it or not, we must link fibroid, there's estrogen dominance and fibroid connection, hormonal imbalance to fibroid to some extent. So I think our lifestyle choice, the kind of lifestyle we live, is also very, very important regarding our fertility. I saw a question where somebody said that taking folic acid and vitamin E will make fibroid to grow. I don't know if vitamins like that could have effect. Folic acid, vitamin E could have effect to make your fibroid to actually grow. Because we are Africans, we believe that we take this, we take that it will work, and it doesn't. But people still don't believe that. And I just want you to, for the sake of this conversation, because for some people it has even make them to lose their lives. Bleeding, excessive bleeding. So it's something we must address and make them understand. Please.
Yeah, Ajayi, the problem is that many people rightfully try to avoid surgery. And so they look for anything that they think can bring hope, even when it does not do anything, So I think that's where most of these things are coming. This is where so many people have also been, I don't want to say scammed, but they've spent a lot of money and without results, with native concoctions, with what have you, because they're trying to avoid surgery. And that is why HIFU is here, that you can avoid surgery and still treat your fibroids. So I think for because I don't blame anybody now. I think everybody does, nobody likes surgery. So, and that's what we're trying to prevent by providing this kind of service. So anything that is not proven, I don't think we should waste our money and our time on some of these things. And I have personal experience to show about that. So, but I just tell people, just let us just stick to what is proven.
There's a comment, someone says a fibroid sufferer that he will advise people not to waste their time and money because she has spent so much without even, because there's so many things online you just see with testimonials, pictures, videos, and people are wow. And they keep asking, even me, can I take this fibroid tea? There's this one, there's that one. They don't work. But if you say it's as if you're coming from some people or so people attack you. I don't know how the correlation between folic acid and fibroid, and so it stops people from, those that are even trying to conceive, from even taking folic acid because they believe that it will make their fibroid to grow.
Nothing, not to my knowledge. I don't have any facts to back that up. And if I'm a scientist, I have to work with the facts.
All right, thank you so much. I think we've said enough regarding HIFU and fibroid, even adenomyosis and the methods, different ways, things you can, options you have, the options you have, keyhole surgery, hysteroscopy that doesn't even involve any cut, and even HIFU, which is the latest in town. So please, I think if they say he who has ears should listen, stop wasting your time. Time is even very, you can even waste money. What about your time? For women, those that are still trying to conceive, you know how important it is. So let's be very, very careful with the things that we take. Please.
Sorry,
I don't know if
somebody's going to get very angry if we don't. She sent a question and she said, read my question. Please read my question out, and we will. She says, is conception possible after HIFU? If yes, when can I start trying to get pregnant after the procedure? I'm 49 years old. Okay. Conception is very possible after HIFU. We say 6 months, you can get pregnant 6 months. Actually, it's been cut down to 3 months, but we still stick to the 6 months that you can get pregnant. Yeah, 6 months after HIFU.
Thank you so much, Doctor. I think if you have one or two things to add for us, maybe I have questions we did not ask or something, please do.
Yeah, well, I think you asked most of the important questions. It's just to tell people that just like you started with, fibroid is not the death sentence. And there's so many options available now, even in Nigeria. But don't just, I tell people there is nothing wrong with the second opinion. Don't rush into anything, especially that involves surgery. Get a second opinion before you go for
necessary third opinion.
Yeah, and then also make sure that this, because sometimes you see some people, they start from a gynecologist and now go to a GP in the name of a second opinion. No, you're not doing well. You know, the second opinion must be at least at par
above
with the first opinion, if not higher, but at least at par. So, but the moment you talk to a gynecologist and then you go and talk to a house officer, and no disrespect to the house officer, but that's not the second opinion.
All right, thank you so much for having me today. And please remember there's another live event coming up on 11th. Please talk about the 11th of June in Abuja. So you can attend physically and you can even get to see the doctor if you are in Abuja, or you can even come down from Lagos or anywhere. Fine, you're invited. But it's happening in Abuja on the 11th of June, and we would like to see you because I'll also be there to be part of the event. So thank you so much, Doctor, for having me today. And
My pleasure. And the venue in Abuja is Valencia Hotel. And it's we say 2, Abuja. And the time is 3 p.m. Saturday, 11th of June.
All right, Saturday, 11th of June at Valencia Hotel, Abuja. Wuse 2, Abuja. Thank you so much and have a great day.
Thank you. Always a pleasure to have a chat with you.
Same here. Bye.
Yeah, bye.